Hello. The following presentation covers the clinical issue of constipation and the various methods utilized to combat and reverse the symptoms associated with it. The clinical condition of constipation presents with some generalized symptoms. Constipation itself is not a disease, but rather the symptom of another condition. It is defined by the presenting symptoms and the duration that these symptoms occur. Some of the most common signs and symptoms of constipation are difficult and painful bowel movements, having fewer than 3 bowel movements per week, and the presence of dilated bowel loops on abdominal X-ray. Of note, individual frequency of bowel movements may vary person to person, but the general principle of 3 per week is a good guideline. Some common causes of constipation are listed on this slide. Some that APRN should be more cognizant of are patients that have prolonged history of opioid use, those with decreased functional mobility causing them to move less and may impact their ability to consume enough fluids in a given day, and those that are utilizing laxatives and/or diuretics for weight loss. All of these causes can be easily addressed with non-pharmacologic management if addressed early. The treatment of constipation and its associated discomforts can start with non-pharmacological prevention. Some of the most common preventative methods are adjust one's diet to include between 25 and 35 grams of fiber daily, increase one's fluid intake, increasing the level of overall physical activity, and having bowel movements when the urge occurs. Holding them in and preventing them from occurring will contribute to accumulation of stool in the body and make it harder to pass the stool next time. Constipation can be alleviated by several measures, including over-the-counter medications, dietary modifications, and even prescription medications when necessary. The American Gastroenterological Association has put out general guidelines to help manage this disorder. The most recent guidelines were published in 2013, with these 2 illustrations assisting with medication and treatment options. The graph on the left shows a treatment plan and options per the individual's response, including certain laxatives and even more invasive measures. The table on the right lists the different medications, their mode of action, and general recommendations for dosing, and even some educational comments on directional use. The links to these articles are supplied below for further in-depth readings. Bulk laxatives are a group of fiber supplementations that increase the amount of liquid in the stool, easing its passage through the gut and thus correcting mild constipation. These medications can easily be obtained at any local pharmacy or large retail store and are generally safe and affordable options to treat chronic constipation. They are available in generic and brand name versions with varying prices. The classification has 3 main formulations, usually acting on the same principle: psyllium, polycarbophyll, and methyl cellulose. They are available in powder and alternatively in pill forms. These medications are typically just supplemental fiber found in nutritious dietary intake, so they will have minimal side effects in the general public. However, the powder forms must be fully dissolved in water as directed by the packers, usually in 8 ounces of water for every 2 grams of powder. They should be followed with 8 ounces more of water to ensure all medication is dissolved. These instructions are not followed, or if the individual has difficulty swallowing or has inadequate liquid intake, these medications can harden the stool too much, predisposing the individual to bowel obstruction or fecal impaction. Children should be supervised when using this medication, as the powder can be a nasal or eye irritant, ensuring that proper usage is necessary in this population. The pill form, adequate instruction, and alternative fiber intake measures could be taken to avoid this complication in older people. Most medications can be taken safely with them. Still, the polycarbophyll formulation is known to have more interactions than other forms, as it contains dietary calcium, which can inhibit the absorption of certain common medications. Consult with your physician before starting or choosing one of the other alternative options if you are taking multiple medications. Osmotic laxatives are a class of constipation relieving medications that are available both with over-the-counter and prescription options. For the over-the-counter options, one of the most commonly used laxatives, polyethylene glycol, is also commonly known as Miralax. Other medications available at your local pharmacy in this class include glycerin, milk of magnesia, and magnesium citrate. These medications are a popular over-the-counter choice for many patients because they typically work more gently than other constipation-relieving agents. They work by drawing more water into the intestines, which leads to softening of the stool, as well as an increase in intestinal volume, which triggers the brain to stimulate bowel movement. Miralax is one of the most popular choices among patients due to its wide availability, ease of taking, and low associated adverse effects. It's available as a powder that is to be dissolved in water and drank. Adverse effects may include nausea, bloating, and cramping, but are less commonly reported with this class of medications. Providers will frequently prescribe the use of Miralax even though it's an over-the-counter medication because of its high rate of effectivity and low side effects. Unlike many laxatives, Miralax can also be used more long-term than other agents without the development of dependence or rebound constipation. However, when used without direction of a provider, the recommended course of treatment is 7 days, consisting of 1 dose per day. The average cost for a 7-day course of treatment is around $13. Overall, osmotic laxatives are a great choice for patients with occasional constipation seeking over-the-counter relief. Stimulant laxatives are comprised primarily of the generic medication Bisacodyl, which is most commonly known over-the-counter by the brand name Dulcolax. Another drug in this class is Senna, which can also be known by the brand Senecot, as well as others. Other generic medications that fall under this umbrella of stimulants include castor oil and sodium picosulfate. The way stimulant laxatives work is by acting directly on the smooth muscle of the intestines, promoting fluid accumulation to increase peristalsis in the colon and small intestines. The biggest adverse effects of this class of laxatives is nausea, vomiting, abdominal cramping, and electrolyte disturbances. Also, long-term use can create dependence. Concurrent use with bowel prep agents is contraindicated, as use with polyethylene glycol solution, also known as Go Lightly, can increase the risk of developing colonic ulcerations, as well as use with sodium sulfate or Suprep can increase toxic effects and damage to the kidneys. Stimulant laxatives are contraindicated in patients with intestinal obstructions, appendicitis, and gastroenteritis. A DDI specific to Senna is that use with digoxin can increase adverse effects and the risk of dig toxicity. Most important things for patients to be aware of is that oral medication should not be taken on an empty stomach and not within 1 hour of taking antacids, dairy products, or calcium. The medications typically work within 6 to 12 hours, but shouldn't be used for more than 7 days without consulting a provider. There should be caution with use in older adults, as the use could cause disturbances in balance and coordination, as well as electrolyte disruptions. Additionally, the use in pregnancy should be limited due to the adverse effects. However, castor oil should not be used in pregnancy, as it could induce labor. The adverse effects and contraindications of this class of medications makes this over-the-counter option second line for patients who are seeking relief of constipation. There are 2 subcategories of stool softeners, surfactant laxatives and lubricant laxatives. The common surfactant laxative you may have heard of before is Colace or docusate sodium. The way it works is by reducing surface tension of liquid bowel contents. That allows more fluid to enter the stool, which softens it and makes it easier to pass. Docusate sodium is most useful for preventing constipation and is drug of choice for patients who shouldn't strain when trying to have a bowel movement, such as postoperative patients or when we want to avoid increasing intracranial pressure. Docusate sodium is very well tolerated, but some patients may experience abdominal cramping, upset stomach, and diarrhea. Capsules are typically 100 milligrams, and standard regimen is 100 milligrams twice per day. Because this medication works by allowing more fluid into the stool, patients should be advised to take it with plenty of water. Generic docusate sodium is very affordable. Patients can get a bottle for 160 capsules for around $6 to $10, depending on where they shop. Docusate calcium is less commonly used, but may be an option for patients who are highly restrictive, low sodium diet. Docusate sodium also comes in enema form, which is much more expensive, but could be a good option for NPO patients. Mineral oil is the only drug in the lubricant laxative category. It works by coating the stool, preventing the colon from reabsorbing water. This makes the stool easier to pass, so it's useful for preventing straining. However, it should not be used concurrently with docusate sodium. Docusate sodium can increase the absorption of the bitterol oil, which can put patients at risk for systemic lipid granulomas or liver toxicity. Mineral oil can also impair the absorption of fat-soluble vitamins, which could potentially be a problem with vitamin K and patients on warfarin. Also, mineral oil should not be given to children, older adults, or bedridden patients due to the risk of aspiration pneumonia. Dosage is usually 30 to 45 milliliters once per day. A 473 milliliter bottle of mineral oil can be purchased for around $3 to $5. Mineral oil can be administered as an enema, which can make hard, compacted stool easier for patients to pass. Suppositories play a key role in helping alleviate constipation. Glycerin suppositories act as an osmotic agent, helping draw fluid into the colon and stimulating a bowel movement, while bisacodyl stimulates colonic nerves directly and alters water and electrolyte balances in the colon. Suppositories can cause negative side effects like abdominal cramping, rectal irritation and burning, and tenesmus, and can be exacerbated by simultaneously taking stool softeners and laxatives. Because suppositories have strong effects, it's important to note that excessive diarrhea may cause electrolyte imbalances, particularly hypokalemia. Vulnerable populations, particularly children, are sensitive to suppositories, and some suppositories are contraindicated. For example, bisacodyl suppositories are not recommended in children under 2 years of age. When other non-prescription methods of constipation relief fail, patients may choose to see a gastroenterologist and seek out pharmacological or other medical intervention for their constipation. Prescription medications for constipation work directly on receptors within the GI tract to promote the occurrence of spontaneous bowel movements. Common examples for each class are listed. The serotonin agonists and secretagogues exert their effect by accelerating intestinal and colonic transport via the potassium or chloride channels. Bile acid modifying agents exert their effect by inducing colonic fluid and electrolyte excretion. The adverse effects for these medications have many principles in common. Some of the most common are noted on the slide above, with abdominal cramping, dehydration, and flatus being the most common. A universal contraindication for constipation medications is the presence of diarrhea and current diagnosis of inflamed bowel. A notable drug-drug interaction that needs to be taken into account with these medications is that due to the fact that they increase colonic transport, there is a risk that certain medications and electrolyte will not be properly absorbed, resulting in therapeutic failure and electrolyte imbalances, respectively. When pharmacological methods fail, there are other medical alternatives. Unfortunately, all of these alternatives are surgical in nature. Sacral nerve stimulation has been found to be beneficial for patients experiencing constipation as a consequence of spinal injury. Other surgical interventions require the removal of some portion of the large intestines, either temporarily or permanently. When discussing these options with patients, it's important to take into account the lifestyle change that will occur and help them address the emotions associated with this. As with all medications, there are safety issues that can occur. Prolonged use of laxatives and stool softeners can lead to intestinal function impairment, rectal prolapse, anemia, alternating episodes of constipation, gas, and diarrhea, and bowel necrosis. Abuse or misuse of laxatives can lead to dehydration, dangerous electrolyte losses, and even lead to life-threatening conditions. It's important to utilize all of the constipation medications as they are intended to be utilized, make lifestyle modifications before or in conjunction with medical therapy, and consult a specialist if you feel that prolonged use of these medications is warranted. So that's the end of our presentation. I hope you learned a little bit about constipation and its treatment options. Thank you for listening.